Hi there, I'm Carolyn Zallmeyer here at LowTE, Florida, and I have the pleasure of having Dr. Derek De Silva here to talk about some of the common sense supplements that we sell on our website. The first one we'd like to talk about is CoQ10, and this is critical. Share with us.
Coenzyme Q10 is a cellular energy nutrient. If you read anything today on aging, and I'm doing a lot of work in aging and longevity right now, anything that has to do with aging, you're going to start hearing about mitochondrial function. The mitochondria are the places within each cell that makes energy. They make what is called ATP. You cannot make energy without coenzyme Q10. Coenzyme Q10 is a cellular energy nutrient. Now, the issue with coenzyme Q10 is that the levels are very nice up to about age 35 to 40. At the age of 40, the levels start to plummet. Now, also, if you're on a cholesterol lowering drug, if you're on a beta blocker, which is a blood pressure heart medicine, if you're on an antidepressant, what are called the SSRIs, or you're on oral hypoglycemics, meaning oral blood sugar medicines, all of those deplete the body of coenzyme Q10. What we also know is that studies that are being done, human studies and even some of the animal data, is showing that if you maintain levels of coenzyme Q10 in your body, you're going to age better.
I read a study or it was an article saying that in Europe, it's against the law for them to prescribe a statin without giving the patient CoQ10.
I believe that.
It's that critical.
I believe that.
We haven't quite caught onto that here yet.
Well, we haven't caught on to that here, which is mind-boggling to me, because there are books written on this. You know, it's not just one or two articles.
Right.
There are literally books written on the importance of coenzyme Q10, and the whole world is on cholesterol medicines. So the most important thing that you can do, if your doctor's prescribed that, fine. You have that discussion with your doctor. But the most important thing that you can do is also add the coenzyme Q10 into it. Oh, and also the reason for that is where cholesterol is made in the liver cell is where the cholesterol medicines work. So it blocks the production of cholesterol, and it blocks the formation or the making of coenzyme Q10. That's where the depletion comes in with this, specifically the statins. Amazing product, 100 milligrams once a day.
Once a day. Does it matter if it's morning or
Morning.
evening? Morning is good.
It's like the B vitamins.
Right.
You know, it's like vitamin D. You want to take it in the morning. You ideally want to take it with a little bit of a fatty meal, but doesn't matter. I just take it in the morning.
As long as you get it in.
Yes.
Great. So common sense, CoQ10, let's get it going. It's for your good health.